There's a thing called a fat folder syndrome patient, which is quite interesting. And these patients go to the doctor almost every few months with something slightly different. The first month they go with a heart beating away, and so the doctor very sensibly sends them for the cardiologist, some expert advice there, maybe a MRI scan, and then they find there's nothing wrong, the heart's perfectly healthy, and so the patient goes away, thinking, well, maybe it was nothing. But a few months later they go along, and now they're getting terrible head pains or headaches, migraines. So again, the doctor sends them off for more examination. Again, they come back, nothing wrong. So another item goes back in the folder. A few months later, they start getting shortness of breath. Definitely a lung problem, the doctor thinks, so we better send him off for more examination, more checks. No, nothing wrong. And the folder gets thicker and thicker by the day. And these are not uncommon. Otherwise it wouldn't have established this name, fat cell folder syndrome patient. I met one such patient when I was training in Buteyko. This was a young lady with a family of 2 whose folder was getting thicker and thicker. Until one day she went along to see the doctor with the latest complaint, and it was a locum in. And this locum said, looked at the folder, looked at her, and said, he pulled a stopwatch out of his pocket and said, I would like you just to hold your breaths for as long as comfortable, please. I'm trying to imitate a Russian voice here. And she did. Hold her breath as long as comfortable, and he measured 5 seconds. Now I would like you to go and see a Buteyko practitioner. Well, this was not easy for her, because at the time, this was about 10 years ago, I think there were about 10 in the country. But she did. She found one in London, saw the practitioner, had the Buteyko training, end of her fat folder. She had none of the symptoms she had complained of over the years. It so impressed her this that she decided she'd train as a practitioner herself. She was on the course with me. She's now practicing in London. So this is real, and I've seen it in practice, in reality.